Universal health coverage is a national goal. And because every country is different, no two paths are exactly alike. But in almost every case, three critical elements need to line up at just the right time: knowledge, demand, and political will. In Thailand, they called it the triangle that moves the mountain. The early 70s brought political change to Thailand. Military rule had given way to a fledgling democracy, and idealistic students were imagining a new future for their country. Young doctors left the cities to work alongside community organizers in rural villages and provincial hospitals. The dramatic inequalities they encountered left a lasting impression on many of them. Over the next 2 decades, a group of doctors quietly started experimenting with small-scale programs that used affordable health to address rural poverty and incorporated the needs and experiences of the communities they were serving. In 1997, they used the knowledge they had gained to draft a health bill that could deliver and finance universal health coverage for all of Thailand. They submitted it to Parliament, where it was promptly ignored. The reformers had neglected a key ingredient. Real change needs a movement to demand it, so they built one.
Today, people living with HIV/AIDS from all over Thailand demand that the government should include antiretroviral drugs in the universal health coverage scheme.
We started off with networks of people living with HIV/AIDS, networks of women, networks of organizations working with children, urban community networks, farmers networks. It was quite revolutionary.
In the end, the reformers brought together over 100 different organizations to give input into the new bill and to make sure it got the nation's attention. The response was overwhelmingly positive, and a newly founded political party, Thai, would soon provide the most critical element for implementation: political will. The party was looking for a platform that would connect with both the rural and urban voters, and they found it in health reform. Rebranded as 30 Baht Treats All Diseases, the party campaigned on a promise of making a doctor's visit cost the equivalent of 60 cents. This simple and memorable policy promise resonated deeply with the average voter, and the Thai party was elected in a landslide. With input from the broad coalition the reformers had built, universal health coverage was implemented in just over 12 months.
There are still a lot of problems that need to be resolved, but bankruptcy and poverty due to illness is really a problem of the past.